Okay, everyone has been alerted that we are recording in progress. We have Tracy weighing in from Atlanta with good vibes. Thanks for joining us, Tracy. And I will be traveling to Atlanta on August 14th to visit a friend of mine. So I will be driving by you down there soon.
Nice.
All right. Oh, yay! Austin, Texas, Stephanie. What do you say? Hook 'em. What's their little thing?
It's about
Longhorns?
it's
Yeah.
got to be
Hook 'em
hook 'em.
horns.
Okay.
Yeah, that's it. I knew it.
Yeah.
Longhorns.
But what is it? Austin, it's like proud to be weird, something about its weirdness, right? It celebrates
Weird
its
or something?
weirdness.
Yeah.
Stephanie, help us out.
Keep Austin weird.
Then weird.
Yes.
Yes. Is it still weird, would you say? Are you feeling comfortable? But
Yeah.
okay.
This is the degree of interaction that we strive for on our webinars. So.
And proud of it. Love it. I really like Austin. Dallas.
All right, Rebecca coming in from Dallas. Pause a statement for the day about they can kill you, but they can't eat you. Wow.
All right.
I like it. I like it. Well, I'm seeing 12 noon, and I am going to go ahead and kick us off. So let me go ahead and close my chat for now. Well, hello, everybody. I am Stacy Hertz, Senior Healthcare Advisor for OSP Labs, and I would like to welcome everyone today to our inaugural webinar, Health Leadership Insights, Challenges, and Solutions of Digital Health Transformations. Now, what's different about this webinar and why I signed on for this is because a lot of webinars in digital health are talking about a lot of concepts and a lot of buzz terms. I want to focus on the people. I want to talk to my guests and I want to focus on what makes them special in the challenges that they've faced throughout their career and some of their best practices and trade secrets that they can carry forward to organizations like yours that are, struggling with the new normal. Coming out of this and facing new digital health challenges. And we're going to learn from the best. And I could not be more excited about my first guest. But first of all, let me just cover a couple logistics. If you do have questions, please drop them in the chat. We will address them at the end. We're going to go till about quarter till, and then I will go ahead and pick up the chat and all your questions. No question's a bad one. You can ask us anything. If you follow me, you know that nothing's off base with me. You can ask anything. So let me just give some context to our chat right now. The healthcare industry is ever growing and expanding. Currently, it represents 18% of the US GDP. With continuous evolution, the health sector would require competent leaders to manage and show the right direction. The application of the software is increasing rapidly in medical devices, health IT systems, mHealth apps, etc. Effective healthcare leadership is required to manage this increased need for digital health technologies. Digital transformation is the process of adopting digital technology to modify businesses. According to Grandview Research, the digital health market will witness a growth of 14.2% in 2021. This is due to the growing demand and rising adoption of digital health technologies. What are its benefits and why is it important in the healthcare industry? Today, we are talking to someone who's been on the defining edge of digital health from some really diverse perspectives: a nonprofit, the tech developer for-profit world, in the for-profit world, and the federal government. It is my honor to introduce someone who has been my mentor and now is my friend, Lygeia Ricciardi. Let's hear about Lygeia's take on this topic, her journey, her struggles with digital health leadership, and how digital transformation can be used to its fullest advantage. Hello, Lygeia. Welcome to my inaugural webinar. I cannot be more grateful for you being my first guest, and it's great hosting you today. How are you?
I am very well, Stacy, and I am so honored to be your inaugural guest. I am so pleased to get involved in basically any activity that you're involved in, because I know that you're really driven from a place of genuine caring and skill and passion and all good things. And it's also just a pleasure to work with you in any way. It's a lot of fun. I love your irreverence, and you're just so authentic and real. So I'm excited not only for this conversation, but for this whole series that you're kicking off.
Well, I'm humbled. Thank you for your kind words. Thank you. So I want to hear about you, and I want to hear about your digital health career trajectory. It has been a myriad of experiences, and there aren't a lot of people who've worked in the health information technology industry from both the public and private sectors, plus an NGO, which is a non-governmental organization. So in all of those experiences, Lygeia, what's been the common thread in your journey?
Yeah, so certainly, first of all, I guess I should say I've been in the general world of digital health or health information technology for 20 years plus at this point. And I have seen a lot of different perspectives. The thing that's really driven me for the last 10, 15 years, especially, is the role of the patient or the person, and the fact that technology gives that person a lot of tools to be a different participant really in their health. I came to this whole area. I was many years ago, I was, a kind of a historian as an undergrad, a generalist, a liberal arts person. And my first job out of college was actually at Harvard Business School. I was working with a professor who was a business historian. And together we were putting together case studies that kind of traced American business history and looked at big trends. And he ended up directing me to write several on information technology, because it was the big thing that seemed to be impacting every element of business and society. So I thought, wow, I'm excited about change at scale. I'm excited about things that really have an impact and make a difference. I want to work on this technology thing. And I want to work on it not just because I see that it can create immense business efficiencies and things like that, but also because it's kind of got some social implications, whether it's in healthcare or in education or in other areas. You're putting information and power into the hands of the people. It's effectively a very democratizing set of tools, or it can be. I don't actually believe that technology is inherently good or evil, but I believe that how we use it is one of the most important questions of our time. So that's how I got into this. And then, so I should say, working on those case studies, I started working on one. My first government agency experience was with the Federal Communications Commission. And I was writing about them for my Harvard Business School case studies. And I ended up, I kind of was really excited. They were asking questions mid to late 90s about how do we regulate the internet? What does the internet even mean for healthcare and for education? And I thought, that's really interesting. So the chairman offered me a job. I went there and I started getting more involved in the policy side, and particularly with healthcare and technology and understanding the impacts and overlap there. So that was my first sort of initiation into the government side of things. But since then, I've also been, as you mentioned, I went to a nonprofit after that. I ended up going back to grad school and wanted to go more deeply into understanding technology and how it impacts life. So I got a degree through the Harvard Graduate School of Education, focused on technology and learning. There wasn't a degree really on technology and health. So I did a lot of work at the MIT Media Lab. Some of it was independent, and pulled in all the pieces I could. Worked at the Harvard Kennedy School as well to understand, like, where is this all going? And yeah, after that, ended up first at my first startup, which was tech and education more. But ended up at a foundation, the Markle Foundation, which was really thinking about the impacts of sharing technology and how it could change health. So got into that. Long story short, many years later, I started to really understand the impact on consumers and thinking consumers and patients. And I wanted to work on that. So I actually started my own independent consulting practice and worked on that for a number of years before jumping back into the government and trying to leverage policies that could empower consumers by getting data into their hands. I've also worked at Carium, among other places, which is a tech company that's building tools that empower consumers, but it's really all about big picture. How can you use technology to help people, to empower the individual, and to improve health?
I love that. I love that. I just love that your common thread is people. I mean, I'm a people person too. And if you can't empower people to use the technology, what good is the technology, you know? And I think that's why you and I bond, because we share that same passion. And
Totally.
I love that. I love that.
There's like untapped potential. It's less untapped than it used to be, but you look at how people can be so much more engaged now. An example that's often used is like travel booking. You know, years ago you'd call a travel agent and you'd be like, "Can you help me navigate things?" Nowadays you just, well, not during, you know, the pandemic, maybe you don't travel anywhere, or you drive or you walk with your mask on, whatever.
Truth.
But you have a lot more agency to figure out, what are my options? What are my costs? What are the trade-offs? I'm going to do it for myself. And that's
Right.
not always entirely a good thing. It
Right.
can mean more work. On the other hand, though, you can get a lot more nuanced about what it is that meets your needs. And I think
Right.
that analogy really works for health and healthcare too. And I realize not everyone wants to be totally engaged in your health, but the reality is, if you're not, or if there isn't someone who's doing that on your behalf, you run some significant, you know, risks, basically, in terms of your overall health and wellness, but also your interactions with the healthcare system.
Yeah. No, no, I love it. I love it. Speaking of which, you touched a little bit on this when you said about not traveling anywhere, but, you know, we're going to dig into a little bit about COVID. And we know, you know, digital health is our present. The strategic and technological shift of the healthcare industry is huge and very rapid due to the COVID pandemic. The acceleration was like this. As one of the most influential voices in healthcare in 2021, what changes have you observed in digital health thought leadership and acceptance from that?
Yeah, so I think I have to start with the point that obviously no one misses, which is that a lot of healthcare went digital because it had to, during the midst of the pandemic in particular. And the pandemic was and continues to be this incredible accelerant. I think we were moving toward greater adoption of digital technologies in health anyway, and the pandemic just forced it. You know, before COVID, 10% of people had used telemedicine, and by people I mean like patients,
Yeah.
to see to see a doctor remotely for something, or to have remote care of some sort. And in the middle, you know, mid COVID, which I guess we still sort of are, unfortunately, we can't look back on this
Agree.
yet. But like 33% do, are some of the numbers, but like that's a pretty dramatic jump.
Yeah.
But what I think is really important in terms of like changes and where's this all going is that it wasn't just an immediate coping mechanism, like, oh, it's not safe to go into the clinic or whatever, so let's do this some other way. 23% of people at least intend to keep using it. And if they have the opportunity, again, if the health system enables and allows that.
Yeah.
I think the other important thing is, it's not just about televisits. It's not just about like video visits. People are understanding that although that was the immediate thing that we had to do, a lot of us during COVID, to avoid people going in and spreading the disease to others, or, you know, you have elderly and other people who are at high risk, at greater, you know, risk of having an in-person interaction. There's so many other ways to use virtual health and virtual tools to support people. So use of sensors, for example, to just kind of track activities of daily living and symptoms and communicate. There are many other pieces to this. And I think the biggest shift is that people have seen this is possible. And by people, I mean within the healthcare system and also outside. There are seniors, for example, who are like, are you kidding? I'm not comfortable with that. Who've realized, not only is this perhaps a great savings in my life in terms of minimizing risk, but also hassle. I mean, I think about you, Stacy, as a caregiver to your son, in addition to being a cancer survivor. You have a lot going on in your plate, a lot of risks to juggle. Many of us have complex lives for whatever reason. it's not easy to do everything in person. And going forward, we shouldn't do everything in person if we can do things that, technology enables us to do remotely instead.
Yeah. Obviously, I couldn't agree more. And thank you for your empathy of my situation with my son. And I think this is I mean, you already talked about all of these options to help empower patients and put power in the palm of our hands. So speaking of which, I want to dig into a little bit about your experience at Carium. You currently serve as an advisor. You were previously the chief transformation officer at Carium, which is a technology company. Would you like to share some of the challenges you faced, and what are some other things from that experience you'd like to convey to our listeners?
Sure. So I think I'll start off by framing this a little bit. This series is really focused on healthcare transformation and big change. And that's the heart of what Carium is focused on as well. It's a technology platform that essentially connects patients, people, and provider teams from a distance and enables them to share data as well as to connect through voice, text, et cetera, or video. But when you ask about challenges, and this is true pre-COVID, but also sort of in the early days of the pandemic too, it's hard to, if you're selling a piece of software, talk to an institution and say like this isn't a small bolt-on. This is like, you will use this software, and in order to use it well, you've got to sort of think differently about everything you do. And that's a big lift. It's an essential one, but it gets to the core of healthcare transformation in general. It's hard for organizations to do things differently. So we found that it made sense, really, as a company, as a growing company, to talk primarily to those organizations who were essentially already bought into healthcare transformation and saw that there had to be another way of doing things that was much more software enabled, and that also started with the needs of the individuals, the patient, the person. If you're not on that journey and I have a conversation with you about my software, it's like not worth it, because that's going to have to be like a 3-year conversation before you even maybe come around to where I'm, coming from.
Yeah.
And I saw that when I was in the federal government too. It takes a little while for these ideas to take root. The idea of like, first of all, what transformation are you trying to make? How do you want it to happen? There are external factors that impact people's readiness for transformation too. One of the biggest ones is, I think, payment mechanisms for care, right? As we all know and appreciate, a lot of care still in this country is structured on fee for service. So companies that provide healthcare services have to sell a lot of them. That doesn't always work out to be in the aligned best interests of patients, nor does it always contribute to the best healthcare outcomes.
Right.
So there are a lot of folks who are trying to deliver care differently, and there are certainly payment models through CMS and through private payers as well that are more outcomes focused. Right. Those organizations tend to be much further on the transformation bandwagon. But yeah, to kind of answer your question, the idea of like, where are people on the mindset of realizing that change has to happen and what does it look like was one challenge. And I also found that if I were approaching, say, a health system, if I just went to somebody who was, for instance, a CIO, and they thought of us as a software product as opposed to part of a bigger piece of transformation, it was really hard to see eye to eye, because it's like technology. And again, this is why I care about this so much. It's big change. Right. It's not like a different way of attachments to your email or something. Like it fundamentally can improve or change or make worse, for that matter, depending on how you apply it, some of your key core competencies.
Yeah, no, I love that. I'm a big proponent of technology being part of wellness, and I think that's what we're talking about here. Like you said, being on that journey and using technology as a tool to advance your wellness and certainly value-based care is we're going to see the shift.
Yeah. And a lot of care, as you know, is more reactive. It's like, wait till you get sick and then go into that. Like, no, you've got to help people along the journey every day to try and cut off problems before they get worse, to try and prevent things. All those pieces are in the bigger vision of transformation.
Yeah, no, I couldn't agree more. And so speaking of which, speaking of, us talking about this good advice. And let's talk about healthcare leaders and how essential is it for healthcare leaders to adopt digital health tools? And in what ways can digital health help them lead their teams to successful healthcare services? You touched a little bit on this, but let's keep pulling that through.
Yeah. So like healthcare is changing. One of the ways that it's changing because of technology is that you have a lot of other players who are in the healthcare space that never used to be.
Mm-hmm.
So as an example, I wish I'd looked this stat up before we spoke, but I don't know, something like 70% of the Fortune 50 companies are in healthcare in some way. That would not have been the case 20, 50, probably even 5 years ago. Like there's this weird world that we live in which not only is the clinic down the street providing healthcare services that I might have had to go to a primary care physician in the past to get, but you've also got companies like the big tech companies, Amazon, Google, Apple, those are all playing in the healthcare space. You've even got major BMW is like putting sensors into cars that enable you to track your heart rate. There, like so many companies are in this healthcare space, and many of them are providing treatment services as well as things that augment and support those things.
Yeah.
So if you are already in the industry, if you're a traditional healthcare provider and you're not aware of this landscape, you're going to get left behind.
Mm-hmm.
Because part of what some of these new entrants are providing is much more consumer-centric or aware care, right? Things that make it easier for a patient to live their life and fit healthcare into their life, as opposed to having to kind of interrupt their entire life just to make healthcare happen. So it's like not a nice to have. It's a, do you want to be in business or not?
Yeah. No,
like essential.
Yeah. I mean, like you said, I mean, somebody who would have ever thought of BMW getting in the healthcare business, you know? I mean, who would have ever thought of, you know, Amazon getting in, Walmart getting in, you know? But I love this term of aware care. I love that, Lygeia. And like you said, I think we're going to see more and more seamlessness, you know, where it's just going to be part of everything that we do. And I, as somebody, you know, who tries to live my best life every day, and you do too, you know, I hope it's a trend that continues and grows, you know, certainly.
Likewise. And I would say people like us, obviously, we're both certainly embedded in and dedicated to the healthcare, health industry, but also we are consumers, patients who vote with our feet. And we're going to choose, even within the traditional healthcare system, those providers who are supportive of our needs. I know you've done a ton in assembling a team. This is not necessarily directly about technology per se, but you have a team of people who, like a crew, who supports you. And you've had to build that. You didn't just like walk into some hospital and get that. You had to build it. And I feel like I've had to do that too. And it's kind of an ongoing process in life as you and the other people that you care for with about experience different, you know, stops on their health journey, let's say.
Yeah. Yeah. A lot of stops, a lot of pivots.
Yeah.
Speaking of which, that's a great segue into our next question in terms of stops and pivots and challenges. I want to talk about, you know, from your experience, what are the common roadblocks in healthcare leadership within healthcare provider organizations when it comes to adopting technology? And, you know, you can give some examples, or what do you think about that? Like, you know, what's holding us back, Lygeia? What do you think on that?
Yeah, I think some of the things that I already touched on. So one is you've got to have buy-in at the highest levels of the organization. Leadership really matters. And you need a leader who lays out a vision of how your organization can provide care that is compelling and exciting that people want to follow and get everybody on board. And not everybody has that. Yeah. And you've got too many, I see we've got some interesting comments in here. I'm trying not to look at the chat, but I also want to hear what you guys are thinking. You know, there are a lot of silos, you know, among different parts of the healthcare system, which is problematic in terms of making change generally. But I would say in terms of just challenges with change. So yes, so leadership, getting leadership that's bought in. The other problem is though, healthcare the process of creating, supporting better health takes time.
Yeah.
So if you work in a tech company, it's very different from working in a tech company that builds a service like, say, Instagram, where the answer is immediately apparent. Like, how many people do we have logging on? How many people are sharing pictures? Did it work or not? Yes, people are happy. Well, with healthcare, it's a little bit more complicated. For one thing, the healthcare system itself is slower pace, as is policy. And I actually respect that to a point, because people's lives are on the line. You don't want to every new month try a new way of doing open heart surgery or something just because you think it might be better. Like, there's caution for good reason.
Yeah.
But on the downside, the cycle for doing things differently within healthcare is very, very slow, and that can be frustrating. The other point is that outcomes can be really hard to track and to see and to link back to a particular factor or factors.
Yeah.
So, for example, if you're making or selling software that helps in the transformation of care, it's just not as obvious a data point of like, are we winning or not, as it is if you're building a platform like Instagram. Yeah. So those are a few of the roadblock challenges, though there are certainly others.
Yeah. No, I love what you said, about the immediate gratification versus the process, of, is this working, and, is it going to work, and how's it going to work down the line, and so if a healthcare provider organization wants to adopt tech successfully, what are some of the things they should keep in mind, or some of the steps that they should take then?
Yeah. So one piece that I would think about, and a theme that I've been thinking and writing about recently, is human-centered design.
Oh, yeah.
So it's the idea that you're developing a process that starts not with like, we are adding tech, but like, what problems are we trying to solve and for whom?
Yeah.
So again, healthcare is a complex universe that has many players in it. Patients and consumers are critically important, central ones, they should be, but there are also many other players, and you have to sort of involve multiple parties in the process of like redesign. Mm-hmm. So let's say, for example, you were trying to think about redesigning like check-in at a clinic, right? And people are frustrated. Patients are frustrated because they drive in, parking is hard, they sit, they wait for an hour, everything's running late. You want to redesign that. But you want to start with involving all the parties that are affected and trying to understand what the root problems are, and not just saying like, well, could we give them better chairs to sit in? Or even, how do we make sure that we reschedule appointments so that there's less wait? Those things are important, but what about asking the deeper questions, which might be things like, hey, patient, what's your deal? Did you have to take a half a day off work and navigate a bus using a wheelchair or a cane to get here? Like, maybe instead of changing the check-in process, we should be doing your visit remotely, this follow-up visit or whatever. So like, think about the root problem and get the voices of the folks who are impacted involved from the beginning. And I know a lot of people are like, oh, that takes time. It's so much easier to just update our scheduling process or whatever. It does, but it's like, do you want to win or not? Do you want to solve the problem? Do you want to help people actually get better and help your institution thrive? Yeah. You can do a quick fix, or you can like really do the work to figure out, how do we do this in a way that meets people's needs?
Yeah. I mean, it's bang for the buck. I mean, like you said, you can make a quick adjustment that, you think is going to solve the problem, but until you actually walk the walk with that end user, who's the patient, who's going to be using that service, and understanding, as you said, their workflow. What is it like, them getting up in the morning, and like you said, catching a bus, figuring out public transportation to get, trying to, and we talk about this all the time, going to a library or a coffee shop just to access broadband to get on their patient portal,
Totally. And then they get their login messed up 5 times and they're frustrated.
Yeah. Right. I mean, and that's or maybe again, they have, we talked about barriers. For them, that's a barrier to health literacy, that they don't understand that process of username and password. that's a very foreign concept for people, and helping them navigate that is just going to go further in the end. So we'll get back.
That's very real. And I think that's true for many populations. I will say I end up, even just this morning, I was helping my mother-in-law navigate a basic like online buying thing. And she's really tech savvy, but still, particularly for seniors and some other populations, it just doesn't come naturally. My father-in-law like prefers to use a flip phone. Like I can't assume that he's going to download stuff from a portal and do whatever the necessary check-in steps are in
Right.
advance. Like what can we do to help engage that person? The other thing that I would say though is human-centered design generally, obviously it's not just about the patient, but providers and others are important components. There's a lot to be said, and I'm not the greatest expert in it, but about, avoiding provider burnout and the immense pressure that a lot of clinicians and caregivers of various sorts are under right now. And that's important to take into account as well, particularly, in the midst of or toward the end of, I hope, a pandemic, which has more than strained the clinicians, that we rely on.
Yeah. I mean, that could be a whole nother webinar, is mental health, like you said, clinician burnout, caregiver burnouts. I know about that all too well. And even let's be empathetic to our industry professionals with the acceleration in digital health, our developer burnout. I can't even imagine if you're working for a software company and you've had this rapid adoption, and developer burnout, that they're working round the clock to get something out that their shareholders have demanded. So, all these tie into bringing the product to market. We talked a little bit. I mean, we've consumers and patients has wrapped around our whole conversation here, but just like standing back, how do you think in general consumers and patients feel about digital health services in general? Are they enthusiastic about them? Are they scared of them? Are they apprehensive? Are they skeptical? What's your take on that?
I think you'll find some people probably who fall into every one of those buckets.
Okay.
But I think by and large, the forcing factor of the pandemic made a lot of people realize that there are ways that technology can be positive that are, that they hadn't really thought about before. I think another thing that's interesting is that people are realizing that it's not only good, for example, to do virtual visits, for example, for physical health, but also mental health. So you have a growing number of people who are doing care remotely. I mean, there's sort of a difference. There are certain types of specialties. Addressing mental health generally is one example where you can really provide care on a real life ongoing basis with immediacy. And there are certainly many conditions that you can treat with remote patient monitoring and with ongoing sort of check-ins for between patients and providers. Obviously there are things that kind of have to happen in most cases in person. You're going to deliver a baby that's got a certain physical component to it, or surgery or whatever. Although to be honest, there are some technologies, as I'm sure that, telesurgery and that kind of thing. But I don't think that's what we're moving toward at this moment. I think it's really a question of, it's not just that technology necessarily is better, but it's a question of like, where is it better? In which use cases, in which situations, right?
That's it.
For all parties involved.
Yeah.
And that's kind of a learning curve, I think. But I think, again, my general sense is that the population of patients and consumers and care partners or caregivers is generally enthusiastic about using more technology in the right settings. And the other thing I'd add too is there continues to be a growth in kind of wellness and health maintenance technologies that people are using totally outside of, in many cases, their interactions with their healthcare provider or the system. So for example, like folks who are using, at-home connected exercise equipment and things like that, that's gone up a lot during, like, that's a piece of health and healthcare in a sense that went up dramatically during the pandemic. And I think you'll see a lot of people realizing, even when it's safe to go back to work or go back to the gym or whatever, at some times it's still more convenient to not do that, depending on the situation. I mean, I've run into that personally with like a yoga studio.
Yeah.
Sometimes I will go in person. I'm very happy to be able to go in person. Yet, if I am traveling, if I have a meeting that starts right after the class or whatever, it is awesome to be able to participate in that and cut out the commute time.
Right. Yeah. And I think, like you said, options are key. Options are key. And having these guide rails to guide patients and consumers on when is it appropriate for in-person, when is it appropriate for virtual care. And, I think patients are seeking that kind of guidance, and that will help them be more enthusiastic about the adoption,
Mhm.
But, and we touched on something I want to swing back to real quick, Lygeia, and that is who's being left behind in this digital health adoption. This is something you and I are both passionate about, is reaching the unreached and inclusion of our, more vulnerable, somewhat marginalized populations. So, what patient populations are being left behind in this increasingly tech reliant world, and what do we do about it, and how can we fill in those gaps?
Okay, that's a lot of questions, and it's a really
Heavy.
important topic. So let's try and do it justice. So who's being left behind? By and large, it is those populations who are already relatively underprivileged. It's people with lesser incomes and education. It's people often who live in rural or sometimes sort of underserved urban areas. It tends to be statistically ethnic minorities, whether it's African Americans or others, Latino populations. It tends to be women relative to men. And a kind of tragic thing about COVID, the pandemic, there are many tragic things about it, but it's had the effect of widening gaps in healthcare and in other aspects of sort of social experience of like life, really. It's widened some of the gaps that already existed. Certainly people with disabilities, you can be left behind in a sense, either because you may not have the right tools to access something. Not everybody has a smartphone, although the majority of the population does, but not everybody does. And not everybody's totally comfortable using it. Not everybody has broadband at home or easily accessible to them. That's an issue. Again, we are doing much better on that than we ever have before, but it's still not all fixed. And even if you do have those things, you brought up this point, Stacey, and it's very true. There's the whole literacy issue. And it's just even understanding what are the questions to ask? What do the answers mean? It's having the comfort level in the weird sort of navigating the power dynamics that sometimes have existed within healthcare to feel like you can ask a question or push back or get a second opinion or say, you know what? I have no idea what you're talking about, and I'm really terrified. Like most people don't feel comfortable saying that, but it's something that probably a lot of us have experienced. So there are a lot of gaps and a lot of issues. And even as we've seen this uptick in technology, we haven't yet, it's made some of those problems worse, which is an issue. What do we do about it? Let's talk about that. I mean, some of those things, let's take broadband access as an example. Having been a person at the Federal Communications Commission, that's partly a policy issue.
Yeah.
It's about subsidizing access to areas that don't have it. Essentially, it's like encouraging the market to provide access where it doesn't already exist.
Yes.
In some ways, that kind of thing could move on, could be encouraged in terms of access to devices and things like that too. There are some programs that subsidize access to devices, but the issue of kind of literacy and moving into communities that are underserved gets complicated too, because often there are issues around culture and trust and mistrust. I think we're seeing this play out a lot in the vaccine conversation, where for often very good reasons, like historical mistreatment of African American or Black populations, is one example, and there are many others as well. You have a fair amount of distrust of authority figures, of medicine in particular. People don't necessarily feel comfortable and trusting of the system.
Mhm.
And so that is a case in which I think we need to, healthcare, whether you think about it being providers or payers or whomever, we need to partner with trusted spokespeople within particular communities. So make a partnership with like a church,
Mhm.
or maybe it's a mother's group, or maybe, there's a lot of different folks who are trusted, and we need to hear voices from a variety of different communities and people who look like you giving you guidance, as opposed to just more like traditionally like the white male who has multiple degrees all
Right.
over his wall telling you this is gonna how it's gonna be.
Yeah. Oh yeah. I always say you buy from people you like. I was in sales, and that was always the old adage. And you relate to people who look like you, sound like you, that you can relate to. And we need to do a better job of those diverse voices and incorporating them into digital health.
We
All,
do. And into medicine and health generally, right?
all of
Into
that,
research.
all of that.
Research about what works is disproportionately geared toward or done on, white males. There are a lot of other people who may react to a particular intervention differently. And we need to see that starting at the research level, but also way out into the sort of delivery and messaging of
Yeah.
like, how do you tell people this is in their interest? Again, something as obvious to me, obvious, I
I
probably don't
know.
want to go
I couldn't
technical, but
agree.
like vaccines and mask wearing and stuff like that, like that should be,
Right.
I'm so disappointed. A huge disappointment for me during COVID
Mhm.
is to see that spread of confusion, distrust,
Misinformation.
misinformation,
Yeah.
fear that is literally killing people. It's so frustrating.
I couldn't agree. It sounds like we're going to have 6 more webinars, but before we pivot to the chat, and before we gather up questions from our friends who are with us today, I want to talk about 2 really exciting things, Lygeia. Number 1, we are
Yes.
both going to HIMSS 21. Yes, we are. Vegas, baby, Vegas. And little known fact about Lygeia and I is that, we formed a strong bonding connection in COVID, but Lygeia and I have never met in real life. And so we are excited to meet in real life at HIMSS 21. And Lygeia, you're going to be speaking. So I want to hear, number 1, what you're speaking about at HIMSS, what you're excited about. And then again, before we pivot to the chat, you're launching a new venture, and I want to hear all about that too. So take it away.
All right, so HIMSS, there is a pre-conference session track called the Patient Experience and Consumerization Forum, which is kind of a continuation of the awesome work done by the Cleveland Clinic, and in particular, Adrienne Boise, who's just so awesome.
Amazing.
Anyway, it's a full day diving deep into patient experience and consumerization. And so I'm going to be on the opening panel of that, talking about what's the state of change at this point, like where are consumers and patients in this new world, and how are we feeling about it, that kind of stuff.
Wow.
I am also, though, just talking about HIMSS in general, I am totally looking forward to meeting you in person, Stacy. I feel like, didn't we meet, but we met before the whole COVID thing, right? I mean, I think we connected but anyway, it doesn't matter. The point is we've never met in person.
We've never met live. Yes, for our audience, Lygeia and I both serve as what was called the HIMSS Digital Influencers, that has now been transformed to the HIMSS Digital Change Makers, because we've expanded our community. And that's how we first connected. And like I said, we really bonded. I mean, Lygeia is my community. Those digital change makers are my community. I get to meet all of them, a lot of them.
Some laughter and a fair number of tears, which I think we're going to get out of this webinar without crying, but
amazing. Well, there's still time. Wait a minute. We still have some time to cry.
But yeah, so I'm really looking forward to seeing you, and honestly to having that human connection with other people, both old friends and people whom I haven't met, because there is something special, notwithstanding all that we've said about the beauty of technology and how it's kept us connected and how it can improve our lives. blah, blah, blah. That is all true. And it is important as part of your life to sometimes meet real people in the same room, face to face, handshake, hug, whatever it is. So I
Right
am
on.
pumped about that.
Right
I'm
on.
also, I should say, I'm happy to be just getting out of my house where I've been under sort of house arrest for like 18 months. So there's that.
Yay, we get
um,
to look pretty and put
yeah.
on makeup, so that's all exciting. Yes.
So that's all good. So in terms of like the new venture, so I started actually during COVID, something that I'm calling Ada Rose. It's a new company, which is named after my daughter, actually, or inspired by my daughter. And it's about patient and person engagement, really. And it's geared specifically toward women, because I realized that much as I've been excited about empowering patients and consumers generally, it's women specifically who make 80% of healthcare decisions for families, for consumers. So we're kind of like these chief health officers, powerhouses of impact,
Mhm.
particularly those of us who are like you and me, sort of in this sandwich generation of like, you have kids, you have elders, you may have a significant other or spouse, and you're often the node, the one who has to manage all of it.
Yeah.
It sounds grand and awesome, the chief health officer, right? You should have a red carpet. It should all be good. People should appreciate you because your decisions influence the flow of millions of dollars, perhaps over the course of a lifetime. Not necessarily, again, the experience for that consumer, that navigator, that person, it's too often miserable and it's a burden. So I'm building this community initially of women to share tips and tricks and navigate the digital health world with like less hassle and more joy. And I believe that part of that is through human connection. Healthcare isn't just about the person and maybe their technology and the professional caregiver community. It's also about people like you. That's true if you have, you were saying that in the context of people being left behind, right? You want to connect with people who have a similar life experience. That's particularly true, I think, if you have a rare disease, you want somebody who knows what you're going through. But
Yeah.
it's also true if you're just dealing with this chief health officer thing. It's exhausting, you know, having teenagers, having your own health questions, et cetera. So how can we as women support one another, learn from one another, and what like tips and tricks, particularly leveraging technology, can we help each other with? So anyway, that's called Ada Rose. It's at adarose.com. Please check it out, people. It's brand new. And I want to make it for you, for us collectively, to make life a little easier, hopefully healthier.
Well, I love that. I mean, like I said, I mean, as a lot of times as a full-time caregiver, you know, I'm very isolated. And so to know that I have a community, you know, that's what I'm doing this webinar for. I mean, we want to build a sense of community, and whatever that means to you and whatever that's important to you, whether you're a woman, you know, whether, you know, you're in an underserved community, et cetera. We want to build community, and we want to find solutions for you to make your life better. Lygeia is passionate about that. So am I. Go check out Ada Rose, my Ada Rose on Instagram. It's the content's amazing. You'll love it. So let's go jump over here to the chat. I'm going to welcome Lygeia too to also peruse it, please, and tell me some things that are important to you that you want to further expand on, and let's touch on that. So we're going to just give us a minute here. Bear with us as we peruse the chat.
I
Well,
will say it is awesome that so many of you have jumped in and kind of shared what you're thinking, or like, this is going on in my world.
I know this
Some
is
of you, I recognize some people we know. I'm looking at you, John Sharp.
John Sharp.
Neelam
I see you.
Sharma, hello.
Hi, Neelam.
A lot of you I don't know, but I'm excited to meet all, at least virtually.
We do have a question about, and you sort of addressed this, Lygeia, the silos between healthcare research, industry, pharma, clinics, and patient centricity are rapidly converging. How can we help this movement grow? And boy, I hope it is growing, and I hope that is happening. We can't go back. You know, our friend Jamie Edwards always says the genie's out of the bottle. So yeah. So what are your thoughts on that, Lygeia?
So I would say this, we and I presume most of the people on this webinar are involved in the world of healthcare on the sort of system side. And there are a lot of different levers that we have to pull, and they may be a little bit different depending which silo you're in, you know, what kind of change you can make. I will say, I think patients as a whole and consumers have not yet like exercised the power that we have to change things. And part of that is about voting with your feet. It's about when and where you get care and making clear the terms on which you hope to participate as like a partner in your health. There are simple things like getting access to your health records and checking them. You've got to check them. That's like a basic thing you should do. Make sure there aren't errors in them. And I'm not like pointing fingers at the health system and saying like bad on them for making errors. Errors happen in life.
Sure.
The difference is like this could save your life or not. So maybe you should make sure it's right because you have like literally skin in the game as a patient or consumer. So you should be active and ask questions and review the information that you have. If you don't understand or feel comfortable with, you know, a healthcare process or question, ask for help. Don't be shy. But I think that speaking generically from the perspective of those in the system, like invite patients in to be partners and participants. Assume that they have information and knowledge that they can share and that they can do. And I mean this in a positive way. I don't mean to overwhelm people who are often very overwhelmed by their health condition anyway, but they can do some of the work in a sense of helping their own selves achieve their best health, because there are things only the patient will know.
Yeah.
Like, right, you're the one specifically who's in charge of what happens in your home most of the time. And that's, again, I'm thinking of your son, Emmett, but I'm thinking, you know, like no provider is going to be able to glean from intermittent visits with him and you exactly what he needs. Technology can help with some of that. Again, things like remote patient monitoring, but you're the one who knows him as a person, who knows what seems right or not right for him, regardless of what the average says on the chart. Like those kinds of things.
Yeah. Agree. Here's a great one for, well, I am seeing some logistical questions about registering. Please go to HIMSS.org. HIMSS, HIMSS, HIMSS.org will have all of the information about HIMSS 21 and registering for the conference, etc. I see, did you see the one, how can women-owned small business get the true support we need to partner with organizations that really want to help? Wow, fierce. I love that. Lygeia, your thoughts?
I will say on my own journey with Ada Rose so far, I've learned about a number of organizations. I'm just going to throw one out there, like Hey Mama is one, but there are so many others. Some of them are more like Facebook groups. Some of them are membership organizations, but there are a lot of, some are more formal, some are informal organizations that specifically do support women-owned businesses. I remember I was a member of the National Women-Owned Business Council. I can't remember the exact name, but the point is, particularly if you are a woman-owned business, you can, depending on your goods and services and so on, you can be classified as such, which can help you and give you advantages in terms of either government contracts or sometimes large business contracts that you can apply for. So there are things like organizations that can give you that kind of like classification as a woman-owned business. That's one way that you can be supported in that role. But there's also the support of connecting to various online communities and groups, Hey Mama being one, that's particularly about working women actually and managing life. But it's not just about like things related to the sort of role of being perhaps a mother or a caregiver. It's also about things like, how do I manage, how do I talk about a promotion when I know I need to be home every day at 5, or other things that are more kind of career and business oriented, given the context of where you're coming from. So I don't know if that's a start anyway. I will also say there are a number of organizations that support women in health IT specifically. I would do a plug for the Hit Like a Girl podcast. I would do a plug for an organization called C Sweetener, which is about mentoring. I've been both a mentor and a mentee on that, so you can get matched with people who have a similar interest. So those are some thoughts.
Awesome. We're going to take a couple more because I know I don't want to go right up to the hour because I know many of you have 1 o'clock calls and whatnot. So I want to be sensitive to that. I have one here. How can systems be developed that do not exclude input and expertise of the caregivers at the bedside? Well, obviously I chose that one. It's one that means a lot to me. But Lygeia, you're so empathetic to the needs of patients, consumers, and caregivers like myself. What are your thoughts on that at the bedside?
Yeah, so actually, I mean, I want to co-answer that, Stacy, because I think you would be as, if not better equipped to answer that than I. But I think the process, again, going back to that human-centered design idea, it's not just about a patient. It's not just about the caregiver and the patient, but professional caregiver, but like who are the care partners, informal caregivers that help make that all possible? Like just by asking the question, you're on the right track. Like ask them, talk to them. And there are folks like Stacy who can, I think, give direct, input from their perspective, right? As a consultant, that's one thing you can do. You can hire somebody who can help you navigate that. There are also a number of other organizations that will help you, like match you with, whether it's patients or care partners, to kind of get their perspective. And you would do that. Think about it. If you were designing, I'm thinking particularly of software or whatever, for some other area of life, not healthcare, of course you would say, like, who's an important player? How do I design for them? You've got to get them in the room, and you got to pay to get them in the room too, often. And I think that's appropriate. Too often, I think there's been this sort of precedent that, like, well, we can just ask patients to give their time or to come to a conference and weigh in or to speak about their situation without compensation because it's somehow in their interest. And yet patients, particularly those struggling with a really complicated condition, probably have less energy, have less time because they're managing their condition all the time. They may have fewer resources because they have other constraints on their life. Like, recognize that as a professional and valuable input to what you're trying to do and its ultimate success.
All of that, all of that. I'm going to start to wrap here. I do see a question, Ronaldo. I do see your question about managing legal issues. I think maybe on a future webinar, maybe we'll have on an attorney who can maybe do a deeper dive into that. And I have somebody in mind that I am going to hit up to be a guest. But as we wrap here, first of all, I want to thank our audience for joining us today on this inaugural webinar with OSP Labs. Like I said, what we're doing is different in that we want to talk to the people and capture, the pearls of wisdom from them. And I'm really proud to be doing something different with OSP Labs. So if you do need a software solution for your company, for your healthcare system, these are some good folks. I came on with them because they're family friendly. They work with me, all of my challenges in my life, and they still want to work with me. So I think that speaks volumes about the people that they are. So please check out osplabs.com for some software solutions. Lygeia Ricciardi, I am in awe of you. I am blessed to be your friend. I am so grateful for you joining me today and sharing your insights and your journey. Your experience has been patient-centric from the get-go. And I can't thank you enough for your tireless work for people like me and other patients and consumers like me. And I can't wait to meet you in person. So thank you so much. And to our audience, if you do have ideas for guests, for people that you think would fit into what we're doing here, please reach out to me on LinkedIn. Drop me a DM if you'd like to come on, share your story, and share some best practices for others who want to model goodness in digital health and digital transformation. So thank you so much, everybody. And we look forward to continuing the conversation on social media. Please follow Lygeia on Twitter. Like I said, we talked about My Ada Rose on Instagram. I'm sure she'd connect with you on LinkedIn. And
Maybe
same.
we can get some of those questions we haven't had time to answer. I see that so many popping up, but don't feel shy about moving this over to another platform.
Yes, we will roll this up and we will get back to you. Thank you for all you do. It's a community, and have a great day. Thank you.